Alright guys, it's Dr. Mohammed. This is Unit 4. We have been talking about safety, and today we are going to be talking about medical errors. In the first lecture on this unit, we talked about quality assurance and trying to make sure that we are providing a safe environment, that things are standardized, that there's a quality improvement process, that things are as safe as possible. Now we're going to talk about the flip side of that, when medical errors occur, the different types of medical errors, and how we can kind of work through those issues. So we're going to start off talking about the different types of medical errors. And the thing that I want you to know right off the bat, before we even get into this, is that errors can occur on multiple different levels. They can occur with individuals, they can occur with groups, they can occur within healthcare systems, an entire hospital-wide error. So all the way from the tech or the nurse or the doctor, all the way to an issue with the entire healthcare system. So there's multiple different levels that errors can occur on. The first type of error that I want to talk about is an active error. And an active error is when a worker makes an error in real time and it causes immediate harm to the patient. This is a big deal. This is the thing that we want to stop first and foremost before anything else, because it's causing immediate harm to the patient. Some examples of these are a patient receiving the wrong medication or an IV being placed in the artery instead of the vein. These are things that in that moment immediately harm the patient. The patient receiving the wrong medication, no good. The IV being placed in the artery instead of the vein, we could start administering medication through that. That would cause further harm. These are active errors. These are things that are causing harm right here, right now. So we want to avoid those as much as possible. The next type of medical error is a latent error, which in contrast is when a worker makes an error that has the potential to cause harm. So an active error, it immediately caused harm. A latent error, it's more latent, it has the potential to cause harm. And the more common way to say this is an accident waiting to happen. There's something that the individual is doing, or there's something wrong with the system, and this could cause serious harm. Examples of this, an x-ray being taken on the incorrect limb, or guardrails on a stretcher being left down. In terms of the x-ray being taken, that's not directly harming the patient right now, but if somebody looks at that x-ray and says it's all normal and the patient gets discharged, they could go home and they could get sicker, they could get even more injured. Guardrails on a stretcher being left down, that's not hurting the patient right here, right now in this moment, but that does increase the potential that they may fall later, and that could cause harm later on. So both of those are examples of latent errors. They are accidents that are waiting to happen. Another thing that I want you to know about latent errors is that there could also be issues with operations or processes that are completely unrelated to the worker, to the individual, that are causing harm. Remember I said, errors can occur with workers, they can occur with individuals, groups, and systems. So some examples of operations or processes that are latent errors that have the potential to cause harm, that are accidents waiting to happen, are a hospital having multiple different types of IV pumps or different concentrations of a medication. These are things that aren't causing harm right now, but if a patient comes in and needs a medication that's placed on an IV pump and it's a different type of pump than the nurse has ever worked with before, that could seriously cause some harm if they're not programming it right, if there's issues with that. So the fact that the hospital has different types of IV pumps, that is an example of an operation or a process that is a latent error and that could cause harm down the road. The next type of medical error that we need to know about is a never event. And this is a little bit intuitive. It's exactly what it sounds like. This is an error that is easy to identify, it's easy to prevent, but it's also very high risk. So these are the things that's a never event. Ideally, this should never be happening. Some examples of this: performing a procedure on the entirely wrong patient, or performing a procedure and the scalpel is retained in the patient from surgery. These are things that are really easy to identify to make sure they're not happening, to make sure that it's not the wrong procedure on the wrong patient. You just ask the patient their name, you check their wristband, you verify their date of birth. These are really easy things to prevent. But if you do that, if you take out the appendix on a patient that didn't need their appendix out, that could cause a lot of harm. Additionally, something like a retained scalpel, this is really easy to prevent. In the OR, we just do counts of all of the different devices, the sponges, the scalpels, all of the instruments, really easy to prevent. But if you leave that scalpel in that patient, that's going to cause some serious harm. And like I said, ideally, these errors should never occur. But when they do occur, it's called a sentinel event. This is when a never event does occur and causes death or serious or permanent harm. Never events should never occur. When they do occur, it is called a sentinel event, and this is causing some serious harm. And this is something that's going to cause legal issues. It's going to need to undergo root cause analysis, which we're going to talk about in a little bit. So sentinel events are very, very bad. The final type of medical error that we need to know about is a near miss. And this is something, it's an error that is unexpected and does not cause harm, but has the potential to cause harm. So this is something that we don't see coming. It's missed, it goes over our head, and it's not causing harm, but it has the potential to cause some very serious harm. An example of this is a pharmacy pharmacist identifies a potentially serious medication interaction and cancels an order. So as the physician, sometimes we order medications, we're not looking through the entire medication list of a patient, we might miss something, but the pharmacist, that's their job, they're going to double check. So they might find an error, a serious interaction that could cause harm, and they're going to discontinue that medication. So fortunately it didn't happen, it was a near miss. It would almost happen, but there was a fail-safe to prevent it from happening. Another example of that, identifying that a patient has a DNR before performing CPR. This is a little bit more of a complex situation, but the patient's wishes are not to have CPR done. So by doing CPR in this critically ill patient, we're actually causing some harm because we're going against the patient's wishes. But identifying that DNR, seeing that MOLST form, like we talked about before, of life-sustaining treatment, and seeing that the patient does not want resuscitation, does not want CPR, is in a way, it's a near miss and it's preventing harm. A couple additional things that I want you to know about medical errors is that some of these errors can be classified under multiple types. So an example of this, when we were talking about a never event, so performing a procedure on the wrong patient, that is something that should never happen. But if it does happen, then it's also an active error, right? That is something that the worker did that was an error in real time that harmed the patient in real time. So just know that some of these examples can be classified under multiple different types. In addition to that, I want you to know that errors can occur because of poor planning and because of poor execution. If we don't plan to do a procedure a certain way, then we may make mistakes and that may cause harm. Conversely, if we don't execute the procedure in a certain way, that could also cause harm. So errors can come from poor planning, but also poor execution. The final thing that's really important to know when it comes to medical errors is that these errors can occur at every step of care, from patient identification to the patient being discharged. So something as simple as forgetting to put a wristband on a patient or putting the incorrect wristband on a patient. That is an example of error. Sending a patient home without discharge instructions or with the incorrect discharge instructions, or not mentioning a medication that was prescribed. Those are all things. Every step of the process in healthcare, there is the ability for errors to occur, which is why it's so important that we go through quality improvement, that we have root cause analysis, those kinds of things, to make sure that we are minimizing error as much as possible. Now that we've talked about the different types of medical errors, we want to do medical error analysis. And I've alluded to it multiple times, but this is going to start with root cause analysis. And root cause analysis is something that is retrospective. We are looking backwards. We are looking at previous failures to prevent recurrence. How are we doing this? There's a couple different methods. We're going to do interviews of patients. We're going to send out surveys. We're going to do chart review. Hospitals do chart review all the time to see things that have been missed. We're going to make process maps. Are there issues with the process and how things are getting done? Are there issues with how we're getting x-rays done? Are there issues in the lab that are causing for blood work results to be delayed? We want to look at all of these things when errors occur to really get to the root cause of it, which is why it's called root cause analysis. We want to break it down to its foundation to find out where the errors occurred and how we can correct that. So like I said, root cause analysis is retrospective. On the other side of that, we also want to do effects analysis. This is prospective. This is looking forward. Root cause analysis was retrospective. We were looking backwards at previous failures. Effects analysis is prospective. We are looking forward to predict the potential of future failures and to implement processes to prevent them. And you can see that these things go hand in hand. If you have a huge medical error, you want to do root cause analysis. You want to look back at that to figure out what caused that error. But then from that point, you want to do effects analysis and you want to look forward to see how we can prevent this moving forward. So this is all a part of medical error analysis. Some examples of effects analysis are things like modeling, creating simulations, using AI, using artificial intelligence, inductive reasoning, looking at these things, breaking them down, creating models, projecting what errors could occur and how we can minimize them or get rid of them completely. The important thing with effects analysis and medical error analysis in general is we are going to prioritize failures by the probability that they might occur. If something has a high probability of occurring, if it has a 99% probability of occurring, then we want to manage that error more than we want to manage the one that has 0.01% of occurring. So really important to know we are going to prioritize potential failures and manage those based on the probability that they may occur. The last thing that we're going to talk about for this unit is burnout. And this is going to be high yield. Everyone's heard about burnout at this point. This is a big deal in our field. Residents, physicians, nurses, all healthcare workers, especially with the COVID-19 pandemic, are burnt out. But we actually need to define these terms a little bit more so that we know what we're talking about and that we know them for the exam. So burnout is basically prolonged and excessive stress that leads leads to decreased efficacy and increased medical errors, right? A resident that's working 7, 10, 14 days in a row, this is prolonged and excessive stress, and because of that, they're not going to be as effective, and they're going to make mistakes. Anyone that's worked in the hospital for a really long time like that, you're not thinking straight, you start making some errors. That is what burnout is. It is from prolonged and excessive stress. Fatigue, on the other hand, is when a lack of stress and rest in particular leads to cognitive impairment and increased medical errors. So burnout, it was prolonged and excessive stress, so you're being stressed in an environment frequently. Fatigue is lack of sleep and rest. Both of these issues are going to lead to increased medical errors, but how we got there is going to be different. With burnout, it was a lot of stress. With fatigue, it's not enough sleep and rest. Quick recap, this is Unit 4, all about safety, and today we're talking about medical errors. We talked about the different types of medical errors. Remember, an active error, a worker makes an error in real time that causes immediate harm. A latent error, a worker makes an error that has the potential to cause harm sometime in the future. A near event, this is something that is easy to identify and easy to prevent, but if it does occur, it is very high risk, and if it does occur, it's called a sentinel event. A near miss is an error that is unexpected and does not cause harm, but it has the potential to cause harm. We just missed it, but it could have caused some serious problems. After that, we talked about medical error analysis. We talked about root cause analysis, which is retrospective. We looked back at previous failures to prevent recurrence. And then we talked about effects analysis, which was prospective. We looked forward to predict failures and implement processes to prevent them. After that, we talked about burnout and fatigue. Remember, burnout is prolonged excessive stress that leads to increased medical errors, whereas fatigue is lack of sleep and rest that leads to increased medical errors. That is the end of Unit 4, and I will see you in the next one.